Whether or not the Affordable Care Act actually works is one story. Whether or not the individual mandate is ethical, I think is another entirely. Do not feel that it is unethical to require individuals to carry health insurance. It is not required that they use it, which would be unethical if they did not want to receive medical care or if they were being forced to receive medical care. However, with that being said, denying someone access to care services is deemed unethical, but it should be the responsible of the individual to provide a means to pay for services that they receive, and under certain circumstances could not be denied. So they should be fiscally responsible for the care that they receive. I'm not a fan of the healthcare system in the United States. Last year I was diagnosed with cancer, and although I was far from pleased with my husband's health insurance plan provided by his employer, I don't know what I would have done if I didn't have it. Not having insurance really is an option, especially when you have children. We make too much money to qualify for any kind of medical assistance like Medicaid, yet we can't afford a $14,000 family deductible, which is what we have for our current plan. All I know is that if I had not had insurance, I never could have paid for my bilateral mastectomy or my reconstruction surgery. Mind you, my mastectomy, this is just the removal of my breasts, not even the reconstruction, so let that sink in. That alone was over $130,000. My oncologist, who wasn't insensitive to my situation, was not willing to do my surgery without a payment in full up front, just to do a mastectomy, which is kind of crazy. So not requiring individuals to have health insurance coverage just to prove some type of point about patient rights seems kind of absurd to me, because I feel like these are the same individuals who would be crying out if they were denied care for lack of payment or the ability to pay. It is not the enforcement of the individual mandate that is the crime. The crime is the highway robbery that has consumed the medical field and its perpetuation. Insulin costs patients $700 or more a month, and an EpiPen is over $1,000. And whether or not you're a child or an adult, it doesn't really matter. It doesn't matter that people need insulin to survive and are literally dying, rationing their insulin until they get their next paycheck. That, to me, is an ethical violation. The right to drugs that you need to live, and being denied those drugs for an inability to pay, to me, that's an ethical situation. With coverage, you still have a choice, and it may be not a great choice, but not all choices are what we would like them to be. The alternative isn't much better, I'm afraid. Thank you.